Hello everyone. This case study will be on Thailand's Universal Coverage Scheme. It will be presented by Elizabeth Davis and Riley Vasquez. Universal health coverage was an ongoing public health issue in Thailand. Health systems failed to protect families suffering from financial hardship to obtain health insurance or access healthcare services. Thailand's population consists of about 16,891,000 and more than 50% live in urban areas. They make an average income of $4,200 per year. In 2001, nearly 1 in 4 Thai people did not have health coverage, yet others had partial protection. Therefore, they could not cover out of pocket when medical attention was needed, which accounted for more than half of their total health expenditures. Thai people had to borrow or sell their belongings with dire straits healthcare needs. Thai women aged 20 to 30 experienced a significant burden with adverse effects on their babies. Unfortunately, 17,000 Thai children under 5 die yearly from preventable infectious diseases. Thailand's efforts to achieve universal health coverage are vital to the country's poor, near poor, and formal sector employees, children, and the elderly health and well-being of its citizens' human rights. Many attempts to improve health equity in Thailand changed in 1975 when the Thailand government began to provide free health services for its poor citizens. However, the lack of health centers to provide services in rural areas was another snag in its efforts. Upon recognizing the problem, the Thai government call to action to strengthen primary care was reallocating its resources to resolve the issue to rural district hospitals and health centers and to train medical and public health professionals and community volunteers. Unfortunately, the large population enrolled in the medical welfare scheme effect caused an economic collapse in 1997. Therefore, this resulted in the weakening of its healthcare system, with 25% of the Thai people still without health insurance due to inequitably distributed and imbalance in medical health indicators. In 1999, the government and civil society collectively refused to claim defeat in providing universal coverage for its people. They forged ahead with a radical change in political reform that included politicians and local non-government organizations advocating for greater equality in health insurance coverage. In 2001, the new government officials, Thai Rak Thai, planned to merge resources with for health coverage but had pushback. Therefore, the compromise in pooled budget from the health card scheme and medical welfare scheme for the poor and near poor. Their efforts resulted in the passage of the National Health Security Act in 2002. Thai government took swift action in implementing the scheme, starting with 6 provinces in mid-2001, which extended to nearly all of Thailand's 75 provinces by the end of the year. In addition to the 18 million people, UCS's total coverage of 48 million insured members and their families. The central administration of its scheme entities were the National Security Office that manages and operates UCS, yet the Ministry of Public Health provides health services. Citizens enrollment, usually a district health care provider network, receives a gold card for free care at home district health centers and contracted hospitals, plus referrals to provincial or tertiary care hospitals in urban areas. Thus, a comprehensive benefits package has similar coverage in pre-existing schemes and is extended to cover costly services. Although Thailand's UCS is funded entirely by the government, its general income taxes primarily finance the funding for the schemes. Therefore, the burden of its cost is not reliant on its Thai citizens, but proportionately more on the rich. So when one visits for services, their initial co-payment of BHT 30, which amounts to like 70 cents in US money, however, its co-payment costs more than its generated revenue following the military coup in 2006, which eliminated this payment due to the new public health minister in support of UCS. After the UCS's launch, health and well-being have improved among women of reproductive age and their infants who were uninsured, and reduced financial risk of affordable access to quality health services for themselves, their family members, and its impoverished citizens. Although some fell below the poverty line, the percentage was reduced from 2.7 in 2000 to less than 0.5 in 2009. The effects were so significant for households with one or more UCS members that are employed, the illness rate became rather low, even for those over age 65, which improved labor productivity. Therefore, UCS's inequality in healthcare services among the poorest Thai people and equity gap in infant health successfully achieved its goal.
A major aspect of Thailand's newly implemented healthcare system was that the system was 100% funded by the government of Thailand. This was made possible through the revenue of their general taxes. It is important to note that the cost of care has a direct relation to the population coverage, quality of healthcare services, and the quantity of certified professional providers in Thailand. In 2002, when the system was first implemented, they were allowed about a budget of 3.6 billion US dollars, as this steadily increased to about 7.6 billion US dollars in 2008. It is important to note that this number is still increasing throughout the years and is a very successful system. In 2002, the U.S. per beneficiary dollar amount was about $35. In 2012, Thailand was able to increase this to about $80 per person beneficiary. This meant that the government had successfully funded its program by depleting funds of other programs without reducing any quality of care and successfully implementing the funds into their universal healthcare system. It is important to understand that it is rare for a country like Thailand, being a low to middle income country, to be able to create such a successful universal healthcare system. They've been able to maintain quality healthcare as one of their top priorities. The wide variety of healthcare professionals has created new input throughout the years, allowing their system to evolve to the country's forever changing needs. Their final result has been working and benefiting all of their contributing parties. This includes different healthcare professionals, academics, doctors, scientists, and representatives of groups and civil society organizations. Each party has been able to successfully contribute new ideas, allowing the country to remain sustainable. Lastly, they have been an inspiration to other and lower middle income countries, providing them with a sample of how to create such a beneficial system. There are many different reasons that contributed to the success of Thailand's newly implemented universal healthcare system. A major reason was that they were able to learn from their past mistakes. Prior to 2002, Thailand did not have a universal coverage system. Instead, they had different patchwork of arrangements for different population groups, each being provided with a different type of care for what they could afford. Clearly, this was not very sustainable, as after 2002, the Thai Party newly introduced within their election the idea of universal health care. They provided a stable and successful leadership from the government from here on forward, as they were able to introduce these new ideologies slowly yet effectively, not bombarding this country with such drastic change all at once. The growth in per patient budgets increased immensely year after year, which was very important for their success because they were allowed further budgets, further access to resources without overspending, which is why it was also very important that they carefully selected which programs would be included in the universal program, as in order to stay within the budget, some systems were not going to be covered, which was actually beneficial to them because they were able to maintain their budget while still providing the same quality care. There were many reasons that contributed to the success of Thailand's newly implemented universal healthcare system. A major reason was that they were able to learn from their past mistakes, as prior to 2002, their health coverage was a patchwork of arrangements for different population groups, as each population group had a specific set income, which provided them with a specific set of health care. This was obviously not a very beneficial system, which was why after 2002, the Thai Party introduced the new ideology of a universal healthcare system. This was important because in order to implement this, they needed to create a stable and strong leadership from their government, which they were successfully able to do. Their leaders were able to implement this new system slowly and carefully without bombarding their country with such a new system. Another important aspect was their growth in per patient budgets. Every year they were able to increase their budget, increase their quality of care, and increase their access to new resources due to their successful implementation of their tax revenue. Lastly, the careful selection of deciding what programs would be included in the program, the universal program. This meant that not all programs would be allowed in the universal program due to their strict budget. A strict budget meant that they were only to provide what they could necessarily provide with quality of care. It was important that the care was quality because without quality of care, the universal healthcare system would have fallen apart, which was why some programs had to be unincluded in the system to allow for other budgets to be met. In Module 6, we were introduced to healthcare systems. The three major goals of a quality healthcare system is to provide good health, create responsiveness to the expectations of a specific population, as well as generating fairness of financial contribution. A healthcare system consists of many different organizations, institutions, and resources whose overall primary purpose is to improve health. I believe that Thailand has successfully completed all three of their goals to create a universal healthcare system. They combated one of the most major issues, which is funding, by creating a tax revenue system. They also put quality of care at the top of their pyramid, as well as other countries doing the same. Despite their form of system, as here in the United States, our system is not a universal healthcare system, we still manage to put quality of care at the top of our priority list. In all systems as well, we are introduced to primary, secondary, and tertiary levels of care. These vary based on the income of the country, being low, middle, or high income, but they all remain the same as being essentially and socially acceptable based on the evidence provided that system or country depends on.